issue of doctors is something that does not come as an emergency or as an unexpected event. The training of doctors, the training of nurses, the training of clinical officers, the training of pharmacists is something that is planned and is known, and every year the number that is coming out is known. So we cannot fail to plan for that if we go by the simple policy we have stated that after graduation, the doctors do internship. 2, we must understand that internship is critical. It is not the employment of doctors or the nurses who do it or the pharmacists. It is a requirement, particularly for doctors, that they do it and then they get registered. So if you fail to get doctors who have graduated to do internship, you will not have doctors, because without internship, they cannot practice on their own, they cannot be employed, and if you intend to export them, despite our shortage, as I often hear, they cannot work out there. So that is something that is not new. 2, the feeling that internship for doctors is a training and therefore that they should not be paid. I've heard that implied is a fallacy. The interns man the hospitals they work in. They are the first on call. They are the first to see patients. They will call their seniors after they've seen them. In many cases, they don't. Interns who have done mid-course, who have done at least 6 months, you will find them doing cesarean sections. And in fact, I would say that if we actually don't have them, I don't know how hospitals will operate. So they are working. Even if we call it training, they are working. They are a workforce. Number 2, we have the issue of UHC staff that were employed on contract, are earning less, and now are to go. I don't understand what policy will do that, because UHC is universal health cover, and we did a pilot, and we are saying we are going to now expand it. If you are expanding a program, how then do you get rid of the people who started the program? That is a policy discrepancy. Why, if it is a program, why should they earn less than their counterparts if they are doing the same work? The word UHC, that was people were employed on UHC, was just a description to raise the money. If we raised the money at that time from the budget, we had enough time to plan, so that as we now implement UHC full time, we take them on, add more, and pay them as everybody else is being paid. So to me, this is a failure to implement policies or poor policies that are also not being implemented properly. So I really think we have no option as a country to plan and implement internship properly from the time people get into medical school or training colleges to the time that they do internships, are released to go and do the work and help Kenyans. For me, it is a policy deficit or just a desire not to implement the policies.
Let's hear from the trade unionist. And then
to the Fourth Estate. I am actually specially elected in the National Assembly by the Azimio Coalition to represent workers. And in that respect, I would just like to say that there is a direct correlation between provision of quality service and proper compensation of our workers. And in this respect, the fact that medical doctors are not only workers, but they also provide essential services that must be prioritized in this country. Yesterday, we did see that the cabinet had actually had a meeting at the residence of the deputy president. And one of the expectations of that meeting was that they would discuss this matter and treat it urgently, and also actually address the nation in regards to the solutions that they have put in place. That did not happen. Right now, we have 11 hours to the strike. And my expectation is that this is a matter that should actually sit at the president's desk, because the buck stops with him. If our doctors are not able to work, if our hospitals are not going to be manned, if the emergency situations that are going to happen from midnight today are not going to be handled, it means that the lives of Kenyans are at risk. This is a crisis, and my thinking is that the president should actually take responsibility and deal with this matter if his cabinet secretary is not able to do so, and deal with it appropriately and with the urgency that it requires. If that does not happen, then the president needs to tell us that he does not know how to do his work, that he is not ready to do his work. Medical doctors have to be given the priority, they have to be given their compensation as it should stand, and National Treasury should also tell us, is it that you don't have money? Is it that you have not collected enough? With all the taxes that you're charging Kenyans currently, why are you not able to pay our workers? And so within 11 hours, as the Azimio Coalition, we want to hear what solutions you have put in place to ensure that you actually avert this strike. Thank you.
And especially an MP sitting on opposition benches, I want seriously support this strike. Today in the morning, I met with the leadership of Doctors Union, and what came out of our meeting today was very clear. There is a serious lack of leadership in the Ministry of Health. Yeah. And I would want to call upon the Minister for Health and the Principal Secretary to resign, because they don't have what it takes to run this ministry. The minister made a very silly mistake when the leadership of Doctors Union wanted to engage her on dialogue. Instead of meeting the leadership, she opted to call interns themselves to bypass the leadership, which means she lacks what it takes to engage, to lead such a serious ministry. And as a trade unionist, we believe in dialogue, we believe in consultations, we believe in literally engagement. But now, if you have a minister who is not aware or who is not able to engage, then there is a very big loophole in that ministry. When you go there, you'll find the PS is talking his own things, the minister is talking her own things. They are not communicating. There is a very big communication lapse between the office of the PS and the office of the minister. So nobody is delivering in that ministry. Instead, there is serious fights. There are serious groupings in the ministry which can bring health sector down. So come midnight, as trade union leaders in this country, we are fully in support of Doctors Union to down their tools come midnight, and we want to ask Kenyans, if you want to fix the issues of health, let us support this strike once and for all. And at the end of this strike, the solution will be gotten. That solution will bring down the poor leadership in that ministry. We get the right people to run health, and the whole country will be healthy. But if we fail to support this strike, we will continue with ailing health system in this country forever. But this is now the right time for all of us to join hands, both workers, Kenyans, health workers, and we fix this problem once and for all. I thank you.